are presenting our agency mapping exercise, which visualizes the institutional structures involved in drug policy implementation in the Philippines. Introduction and purposes. We begin the Dangerous Drugs Board, DDB, the central policy-making body for drug prevention and control. Under Republic Act No. 9165, the DDB is mandated to develop a comprehensive, integrated, and balanced national strategy. It governs 17 member agencies, each with distinct mandates, to implement the National Anti-Drug Plan of Action. This exercise aims to clarify how various agencies coordinate across mandates policy making, enforcement, education, and rehabilitation, and how jurisdictional boundaries influence their rules. Our map is grounded in Republic Act No. 9165, the Comprehensive Dangerous Drug Act of 2002, and reflects actual operational relationships observed in field settings.
National level agencies and their mandates. At the top of the coordination structure is the Dangerous Drugs Board, or the DDB, which formulates national strategies and guidelines for drug prevention and control. The Philippine Drug Enforcement Agency, or the PDEA, serves as the lead implementing arm for enforcement. While the DDB sets policy, PDEA executes operations, raids, surveillance, and intelligence gathering. It also manages the One Nation Against Drugs dashboard, which consolidates data from local government units, or the LGUs, the Department of Health, or the DOH, and other law enforcement bodies. Coordination with the Philippine National Police, or the PNP, is essential, but PDEA holds primary jurisdiction over the anti-drug operation as clarified in Section 82 of Republic Act No. 9165. The Philippine National Police, or the PNP, support PDEA through intelligence gathering, arrest, and community policing. While PDEA has exclusive jurisdiction over high-level operations, the PNP plays a critical role in local enforcement and public visibility. The Department of the Interior and Local Government, or the DILG, mobilized LGUs and Peace and Order Councils. It ensures LGU compliance with community-based rehabilitation programs and barangay drug clearing operations. Coordination with PDEA and DOH is critical, especially in balancing enforcement with public health. Its role is operational, guided by the DDB's policy framework and reinforced by joint memorandum circulars.
Local government units and barangay level structures. Local government units are mandated to implement anti-drug programs within their jurisdictions. They serve as the operational bridge between national agencies and community-level actors. At the barangay level, the Barangay Anti-Drug Abuse Council is tasked with identifying drug personalities, conducting interventions, and promoting awareness. BADAC reports to LGUs and coordinates with the PNP and PDEA. This layer structure ensures that national policy is related into local action, but it also reveals challenges in resource allocation, training, and jurisdictional clarity.
Insight gaps and conclusion. Our mapping reveals both strengths and gaps in interagency coordination. For example, enforcement rule between the PDEA and PNP can overlap, leading to confusion in operational jurisdiction. BADAC's effectiveness is highly dependent on LGU support, which varies across the regions. In conclusion, this exercise highlights the importance of integrated governance. Drug policy implementation is not the sole responsibility of one agency. It requires synchronized effort across the national, local, and barangay levels. By understanding this relationship, we can advocate for more responsive, efficient, and community-centered approaches to drugs prevention and rehabilitation.
Education, Health, and Social Services. The Department of Education, or DepEd, integrates drug education into the school curriculum. promoting awareness and prevention among youth. It trains teachers, engages students, and works with the DDB to ensure its programs align with the national strategy. DepEd also coordinates with the DOH and DSWD to support students affected by the substance use. Its mandate is grounded in Section 77 of Republic Act No. 9165, which emphasizes preventive education as a pillar of drug control. The Department of Health oversees treatment and rehabilitation centers, providing medical and psychological services to persons who use drugs. It ensures that drug dependency is treated as a medical condition, sets clinical standards, and delivers aftercare services. Coordination with the DSWD supports reintegration, while alignment with the DDB ensures that health-based interventions are integrated into the national strategy as outlined in Section 76 of RA 9165. The Department of Social Welfare and Development, or the DSWD, supports reintegration efforts by offering family counseling, livelihood assistance, and community-based rehabilitation. These agencies coordinate horizontally to ensure continuity of care and reduce the risk of relapse.